Welcome to this very special event to celebrate the launch of the Safe Water Optimization Tool. We have an audience from around the world. We have academics, non-academics, and people from a multidisciplinary perspective and from a broad range of specializations. As is now the very welcome tradition in Canada, I'd like to begin this meeting by acknowledging the traditional Indigenous land on which York University is situated. York University is situated on the traditional territorial area known as Takaranto, and we acknowledge its current treaty holders, the Mississaugas of the Credit First Nation. The territory is subject to the Dish with One Spoon Wampum Belt Covenant, which is an agreement to peaceably share and care for the Great Lakes region. Personally, I am very grateful to work, to live, and to raise my children in this beautiful, traditional, unceded territory. Because this is a virtual webinar, some, in fact, most participants are on a different territory. So please take the time and the space over the next hour to give thanks and gratitude to the land that we are currently living and working on. My name is James Orbinski, and I'm a practitioner, an advocate, and an academic in global health. And I've been doing this now for about 30 years. I'm the inaugural director of the Dadala Institute for Global Health Research here at York University. And this institute has come into being because of the generous donor support of Victor Daldala and the generous support of York University itself. I'd like to thank Médecins Sans Frontières, Grand Challenges Canada, ACMEA Foundation, and the ELRA Humanitarian Innovation Fund for their generous support and partnership in the development of the Safe Water Optimization Tool, which brings us together today. The Institute, the Dadala Institute for Global Health Research, has been in existence for 3 short years, and we're committed to critical problem solving, an approach to achieving greater equity, greater effectiveness, and to excellence in global health research. Our 3 thematic research areas are planetary health, global health and humanitarianism, and what we describe as global health foresighting. To begin this afternoon's program, I would like to welcome the president of York University, Dr. Rhonda Lenton, to give welcoming remarks. Rhonda, please.
I'm here. Yeah. Thank you so much, James. Good afternoon and bienvenue à tous, bonjour. On behalf of York University, I really want to extend a warm welcome to everyone here to celebrate the launch of the Safe Water Optimization Tool, or SWOT. I would especially like to acknowledge a few individuals: Research Fellow Syed Imran Ali, founder and lead of SWOT; James Orbinski, our SWOT advisor, professor, and the inaugural director of York's Dadala Institute for Global Health Research Institute; and all of today's panelists, the SWOT team, and everyone here from the Dadala Institute. I've had the opportunity to actually read some of the details of SWOT, and I'm just incredibly inspired by being part of York University and the impact that we continue to make. Throughout the COVID-19 pandemic, we've really seen the entire York community come together to continue to support one another, but also to continue to make a contribution locally and globally. In April, we learned that York had been ranked 33 out of 767 competing universities from around the world in the Times Higher Education Impact Rankings, which really measure a university's contributions through their research, stewardship, outreach, and their teaching on contributing to the United Nations 17 Sustainable Development Goals. And I mention this because impact, driving a positive change, writing the future, these are key ways in which we measure our success at York. There are many ways that I could share with you that York drives that positive change in the world around us, but certainly one important way is through innovative research activities. And the impact of these activities is amplified by the partnerships that we facilitate between research experts government, industry, nonprofits, and community agencies, which allow our researchers to take on those complex global challenges like inequality, homelessness, systemic discrimination, climate change, and global health issues. York is known for our long-standing leadership in global health, and that leadership has helped us to make critical contributions to pandemic recovery efforts. Just last week, we celebrated the 1-year anniversary of the Global Strategy Lab at York being designated a World Health Organization collaborating center on the global governance of antimicrobial resistance. By designating the lab as a collaborating center, the WHO has recognized the outstanding work that the Global Strategy Lab has been doing to find ways to assess the problem of antimicrobial resistance and to address it on a global scale. Another excellent example of York's leadership in this field is through the work that we are here to celebrate today, which has been led by the Daedalus Institute for Global Health Research in partnership with Doctors Without Borders. Home to the highest caliber of global health research, the Daedalus Institute engages with policy, with practice, and science to strengthen global health equity. This new project will be particularly impactful since clean water is fundamental to addressing the basic needs of any community. In humanitarian settings, such as refugee and internally displaced persons camps, water is generally collected from a central point, and while chlorinated, it can easily become contaminated with waterborne viruses after collection. The SWOT addresses this issue by using concrete applications of artificial intelligence to reduce waterborne infectious diseases and ensure that the water remains safe to drink. Water, sanitation, and hygiene are key considerations in reducing the risk of spread of COVID-19, and this timely and groundbreaking tool will be invaluable for safeguarding humanitarian operations around the world. Today's launch also gives us the opportunity to recognize the contributions that the researchers from York's Lausanne School of Engineering, Department of Mathematics and Statistics, and the York School of Global Health made to this project, along with those made by our partners at Doctors Without Borders. The challenges of global health are not limited to any one discipline, and this initiative is a model for the type of positive global impact that's possible when we take advantage of opportunities to collaborate across disciplines and across sectors. On behalf of everyone at York, it is my pleasure to congratulate Syed, Imran, and the entire SWOT team on this outstanding achievement. I want to thank you for the important work that you do, and I wish you and your team the very best for continued success. Merci, miigwech.
Thank you, President Lenton. I'd like to add that the Institute has come into being under Dr. Lenton's leadership, and we're tremendously grateful for her ongoing support. And Dr. Lenton has also catalyzed a new initiative at York on disaster and health emergency management, and has established York University as a UN International Training Center. The Daedalus Institute at York is engaged in both, as both again highlight the vital importance of critical problem solving for greater equity, effectiveness, and excellence in global health. To come now to the question of the SWOT and why it's so important, I'd just like to make a couple of very quick comments. In December of 2019, before COVID, 168 million people were projected to need humanitarian assistance in 2020, largely because of conflicts and extreme climate weather events. 46 million of that group of 168 million are in internally displaced persons camps, and at least 26 million are in refugee camps. And in all settings, safe, drinkable water is vital to life and is the first priority of humanitarian actors. Water in these emergency contexts and in all peace contexts is vital to and is the source of life. Our human bodies are 60% water. Where there's no water, there is no life. And yet the single greatest and most significant threat in internally displaced person settings and in refugee camp settings is waterborne infectious disease. In my own 30 plus years of working internationally, in famine in Somalia, in civil war in Afghanistan, in safe zones in the Rwandan genocide, and in literally the chicken coops of Kosovo, where refugees were forced to seek shelter, I've seen waterborne infectious diseases literally wreak havoc, impose enormous suffering, and take far too many lives. Access to safe drinking water is absolutely pivotal to the well-being of every community, and even more so in humanitarian settings. And today, as global ecological degradation and climate change grow in their impacts, access to and even conflict over water for irrigation and for safe drinking are only likely to grow as issues of primary, fundamental, pragmatic importance. Again, the importance of critical problem solving with a focus on equity, effectiveness, and excellence is really, really the lens with which we seek to approach this issue of access to safe, potable water. And we seek to do it around research, policy, and practice. What has been created by this team, the Safe Water Optimization Tool, is an innovative data analytics tool that helps humanitarian responders protect public health during emergencies by helping ensure that water remains safe to drink up to the point of consumption in, for example, refugee camps and IDP settings. It's among many other research projects that we're engaged in at the Institute. For example, we're engaged in modeling the health impacts of climate change. As Rhonda just previously alluded to, we're engaged in research around antimicrobial resistance, around zoonotic disease, and in flood modeling and mapping. And that is in relation or in partnership with our colleagues at University of California, Irvine. The Safe Water Optimization Tool, or the SWOT as we call it, can be used to ensure that water can be kept safe to the point of consumption many hours after collection. It is a highly, highly innovative tool and is also an example of how the Institute tries to bridge the university and its research capacity with the pragmatic needs, skills, and competence of field-based practitioners, and how we try to bring rigorous scientific and technological research skills to bear on real-world challenges and problems. We're able to create, with this particular approach, new knowledge, new tools, and new practices that help to improve on-the-ground operations and public health in crisis settings. The tool is here to stay. It has been launched, it's been tested, it's been prototyped, tested, and now launched. So please do take it on, use it, learn from it, and share with us your experience so that we can continue to improve the tool and we can continue to improve our broader humanitarian water engineering agenda. We are deeply committed as an institute to working with practitioners from all stripes of the humanitarian sector. So please do reach out to us and share with us your experience and your suggestions on how to improve this particular tool and also how to improve our broader agenda around humanitarian water engineering. I would like now to invite Dr. Imran Ali to turn on his video. And Imran will tell us the story behind the creation of the Safe Water Optimization Tool. I'm then going to moderate a panel discussion, excuse me, with the SWOT development team and hopefully take some of your questions, which we will pose to the panel and seek their commentary. Dr. Syed Imran Ali is an aid worker and an academic. is focused on humanitarian challenges at the intersection of environment and public health. He's worked in emergency responses and led operational research with Médecins Sans Frontières and the United Nations High Commissioner for Refugees in South Sudan, in Pakistan, Jordan, Rwanda, and Uganda. He's taught at the University of California, Berkeley, where he was a postdoc fellow in the Development Impact Lab. And he received his doctorate in environmental engineering from the University of Guelph and his bachelor degree in engineering from Queen's University here in Ontario. Just before I ask Imran to begin his presentation, I would just remind people that questions can be submitted, through the Q&A box. And this feature can be found in the bottom of your screen, slightly to the right with the two message icons. And if we don't get to your question during the session, then please reach out to us via email. And it's at hello@safeh2o.app. And our team will be happy to follow up. You can also reach out if you didn't quite catch that email address. You can also reach out through the Dadala Institute website, which that would be me. Sorry about that. You can also reach out to us through the Dadala website, which you can easily find just by Googling Dadala Institute for Global Health Research. Imran, over to you.
Well, thank you very much, James, for those kind comments and kind introduction. I've said this before you many times, and I'll just say it again. Thank you so much for helping to create this space that does concrete work to help improve the health and well-being of people living through humanitarian crises. The Dadala Institute, as you mentioned, has become a real bridge that connects the humanitarian response world with the university. And thank you for not just giving this technological research a home, but also research on the larger questions of what is humanitarianism in the 21st century, including the work that our colleagues Lynn, Maisa, Rhonda, and others are doing here at the university. So thank you so much for holding the space open for us. President Linton, thank you so much for being able to join us today and mark this occasion. The SWOT is very much a product of York. York is an institution that's oriented towards justice and sustainability, and is focused on the pursuit and practical application of knowledge. So thank you for your support of the SWOT, the Dadala Institute, and of humanitarian and disaster emergency management research happening here at the university more broadly. I'm going to go ahead and share my screen here. And I hope this is visible to everybody. Okay. So let me begin there. Okay. So before I dive into anything, what I really want to do is acknowledge all the folks who have been involved in this research and making the SWOT into what it is today. I want to thank Professor Usman Khan from the Department of Civil Engineering at the Lausanne School here at the university, who leads our ML research program. I want to thank Professor George Manette from the Department of Math and Statistics, who advises us on statistical matters. Michael DeSanti, who is our graduate student researcher with Professor Khan and I working on the ML research program. And our Syed Saad Ali, who leads the numerical modeling research analytics with myself. And then I want to thank the undergraduate student researchers in Professor Khan's group, Rama Khalid, Dalia Adler, and Apostolos Vasileo, who have contributed to the ML work in the early stages. Going over to the field ops and communication side, I want to thank Matt Arnold, who's been our technical advisor and field partnerships lead, Katie Thompson, our practicum student who helped develop some of our communication outputs, and our newest team member, Naeem Munir, who's leading up the project management and administration responsibilities of the project, as well as helping us with some of our dissemination and communication activities. On the technology and design side, I want to thank Mr. Mike Spenlove, who's our technology advisor. Mike brings many years of experience of leadership in the software industry to the SWOT, helping us build a web product that's best of class, uses the best in technology. And he also shares a unique perspective because, like many of us, he's also an MSF where he's worked as a logistician in DRC. So he understands both the technology and the field. I want to thank Mohammed Mossali, who is our full stack developer, and Nawuto Zonda, who is our designer. They recently joined our team in the past 6 months, and it's been great working with both of them as well. Of course, James, who's been our advisor since the very beginning of this project. Jeff Vestley, who is our lead at the MSF side, who's been a champion of this research since we first observed the problem in South Sudan in refugee camps. And of course, last but not at all least, Professor Spiros Bagiotakis, who's our engineering advisor at the Lassonde School of Engineering. Thank you all very much for your contributions to the SWOT and helping us build this thing today. I also want to thank and recognize our core funder whose support has been essential for building the SWOT and starting now to scale it. I want to thank the Acmea Foundation, Grand Challenges Canada, and the Humanitarian Innovation Fund at ELRA for your support. Thank you all very much. Now, of course, we can build whatever fancy technology, but it comes down to people using it in the field. So I also want to acknowledge our implementing operational partners as well. First and foremost, I want to thank the SWOT Steering Committee, the WATSAN unit, and the IT department at MSF headquarters in Amsterdam, who've helped us build and implement the tool. Thank you all for your support, for your guidance, and keeping us on track. I also want to thank the MSF field teams in Nigeria and in Bangladesh, where we've carried out pilots of the SWOT, as well as BRAC, a local NGO in Bangladesh. Finally, I want to thank UNHCR, the UN High Commission for Refugees, and the Norwegian Refugee Council, NRC, for their support as early adopters of the SWOT and the work implementing it in Tanzania. Thank you all. We look forward to continuing to implement and refine the SWOT with your feedback. So let me get into it. Today, in about 20 minutes, I want to tell you about what the SWOT is, why we built it, how it works, how well it works, and how you can use it too. So the first question, what is it? The Safe Water Optimization Tool is a web-based data analytics tool that generates site-specific and evidence-based water chlorination targets for water systems in refugee and IDP camps. The SWOT helps humanitarian responders protect public health during emergencies by helping to assure water remains safe to drink up to the point of consumption in people's shelters. And it does this by unlocking life-preserving information in the water quality monitoring data that is already being collected by humanitarian agencies and water supply projects all over the world. Now, as emergency WASH practitioners ourselves, we built the SWOT to help overcome a major problem in refugee camp water safety we observed during a major waterborne disease outbreak in South Sudan. The image you see here on the screen is of a hepatitis E isolation ward in the Batil refugee camp back in 2013. At this time, I was working as a water and sanitation specialist with MSF in these Maban County camps in South Sudan. Our technical advisor, Matt Arnold, was also there in these camps, and I'm sure some of the folks listening in today were also there too. Now, the Maban County camps were in rough shape. They were overwhelmed, underserviced, and faced multiple outbreaks of waterborne disease, including hepatitis E. Now, hepatitis E is a vicious waterborne disease for which there's no cure. All we can do medically is offer supportive care. In the general population in these camps, the crew fatality rate associated with hepatitis E was around 2%. However, for pregnant women in their second or third trimester, that crew fatality rate jumped to 20% for reasons we don't understand. What this meant was that oftentimes when we had one case come in, unfortunately, it meant 2 deaths, as a child would either pass away in utero or be delivered so prematurely they had very little chance of surviving in this setting. Now, this was incredibly difficult for the entire MSF team to witness, and affirmed our resolve to beat back the outbreak in the community by preventing the spread of the pathogen that causes it. As a waterborne disease, to do this, we had to improve WASH, water, sanitation, and hygiene services in the camp. Now, one of the things we were working on at this time was improving water supply and water safety in the camps. To do this, we were guided by the core humanitarian standards on how to chlorinate water to make sure it's disinfected, and then has some residual protection to keep it safe. The core humanitarian guidelines, such as the Sphere Handbook or MSF's Public Health Engineering Manual and many others, all generally say the same thing with respect to chlorination. That free residual chlorine, or FRC for short, at water distribution points should be between 0.2 and 0.5 milligrams per liter under normal conditions, or increased to 0.5 to 1 milligrams per liter when the pH or turbidity of the water is elevated. Now, we were using this guidance in South Sudan, but even when we achieved these targets at water distribution points, when we went to refugee shelters to test the water they were actually drinking, very often we found no residual chlorine protection. In fact, the US Centers for Disease Control, the CDC, and a group of virologists from the University of Barcelona also came in, and they found evidence that water in people's homes was fecally contaminated, all in the midst of a major waterborne disease outbreak. Now, this was extremely concerning for us. We started to do some digging, And we discovered that these FRC standards in the Sphere Handbook are not actually based on field evidence from humanitarian settings. Instead, they're taken from the WHO guidelines for drinking water quality, which are meant for municipal pipe water systems in cities. Now, of course, in a city, we drink water directly from the tap in a relatively hygienic setting. In a refugee camp, people have to collect the water from a public distribution point, the tap stand. They have to carry it through the camp back to their shelter up to half a kilometer. They then have to store and use that water in their home for up to 24 hours, sometimes even longer. All these times present opportunities for recontamination to occur after water is collected. In fact, there are many reports of water being recontaminated after distribution, leading to the spread of waterborne illnesses amongst displaced populations. It's that last mile of water supply after it leaves the tap that really matters for public health. We presented our concerns about the Sphere FRC guidelines as we observed in South Sudan in a report in the Bulletin of the World Health Organization. If you want to read more, you can find that paper by scanning the QR code on the screen with your phone. Now, as we looked at this problem, we realized it could be affecting water safety in refugee and IDP camps, humanitarian responses all over the world. But this gave us an idea. Humanitarian agencies are regularly collecting water quality monitoring data and water supply projects all the time, including FRC data. There's potentially life-preserving information inside that data on how the residual chlorine protection degrades with time after water is collected from tap stands. If we could build analytics to help unlock this information and put them up on the internet, field workers anywhere in the world could simply upload their FRC monitoring data and use it to generate a site-specific and evidence-based FRC target that helps ensure water remains chlorinated for the entire duration that it's stored and used in people's homes at a given site. And this is what really matters for public health: safe water where people actually drink it. This is the Safe Water Optimization Tool. Now, let me zoom in on the analytics we've developed for the SWOT really quickly. We've developed two ways of analyzing FRC monitoring data to figure out how much FRC needs to be at tap stands in order to provide adequate household protection. The first is based on the numerical modeling of chlorine decay, and the second is based on artificial neural networks, or ANNs, a machine learning approach. In the numerical modeling approach, we use a general integrated rate law to create an overall empirical representation of post-distribution chlorine decay using paired FRC time and data from tap stands and households. And I should mention, this is the first time anybody's attempted to model what happens to chlorine in water after it leaves the distribution system. There's quite a bit of literature, quite a bit of technology for modeling in distribution systems. This is the first time anyone's looked at it, what happens after distribution. So it's a whole new engineering problem for us to solve. The modeling post-distribution chlorine decay as a function of time allows us to design FRC targets that can protect water for different durations of time depending on local requirements. Now, we present this method and demonstrate its application in a paper that I'm very happy to announce has just been published yesterday in the journal Water Research. This paper is open access, so anyone can download it and check it out. That QR code on the screen can take you there. The other analytical engine for the SWOT uses artificial neural networks. Now, ANNs are a type of supervised learning algorithm for machine learning that mimic the structure of a neuron. That's the image at the top right there, in which a set of inputs get mapped to a set of outputs. The analogous situation in an ANN is shown in the image below. So that conceptually is what is happening with an ANN. Once trained on real-world data, an ANN can then be used to predict what the output will be when presented with certain inputs. Now, the advantage of ANNs lies in the data-driven nature. This means we don't need to have an a priori physical relationship to link tap stand FRC to household FRC, as we do with the numerical modeling approach. This allows us to easily use different kinds of data besides just FRC, including other water quality parameters, water handling practices, and environmental data, wherever there may be a signal linking the input to the output. Currently, we've developed ANN models that uses inputs tap stand FRC, water temperature, and electroconductivity, and we continue to evaluate other variables through input variable selection methods from machine learning. The development of the SWOT ANN analytics is described in a forthcoming paper being led by our graduate student, Michael DeSanti. Now, on the basis of these analytics, the SWOT generates a recommendation sent by email to field workers on how much chlorine they should have at tap stands in order to ensure the water remains protected for the length of time that they specify. Implementing this target helps achieve the public health goal of having water protected when and where people actually drink it. In addition to the analytics, the SWOT also provides a clear overview of water quality at multiple project sites. This can help program managers at the country or the headquarters level coordinate and ensure program quality across their projects. And we're now working on enhancing the data visualization dashboard capabilities within the SWOT web tool to make this feature even better. The SWOT requires no additional water quality monitoring equipment or personnel other than what would normally be in place in a water supply project. It simply requires a small reorganization of FRC monitoring to focus on both the tap stand and the household instead of just tap stands. This is in fact recommended in the latest version of the SPHERE handbook because it's water quality at the household that really matters for public health. The SWOT can then help unlock this life-preserving information in that monitoring data. The SWOT can generate a site-specific chlorination recommendation with just 100 to 150 paired tap stand household data points, which can be collected in about 3 to 4 weeks of routine data collection. I realize this might be on my screen. Apologies. The SWOT chlorination recommendation adapts to changing conditions in the field as field workers continue to monitor and upload water quality data. Now, we know from previous work in refugee camps in Jordan that seasonality strongly affects chlorine decay, so chlorination levels need to be periodically adjusted throughout the year. The SWOT can help us do this. So how well does a SWOT work for actually improving household water safety outcomes? To answer this, we carried out a 6-month-long proof of concept pilot study at the Kuduplam Bolakali refugee site in Bangladesh with MSF, which shelters Rohingya refugees, in order to evaluate if the SWOT could lead to improved household water safety outcomes compared to the status quo SPHERE guidelines. At Kuduplam, the SPHERE FRC targeted tap stand resulted in about 43% of sampled households having sufficient chlorine protection 15 hours later. 15 hours later was a time we learned was people usually stored water at the site. On the other hand, the SWOT recommendation resulted in 85% of sampled households having sufficient chlorine protection 15 hours later. In other words, implementing the SWOT chlorination recommendation at tap stands would double the proportion of households having safe water at the Bangladesh pilot site compared to the status quo SPHERE guidelines. We're now preparing a formal write-up of the Bangladesh trial that we hope to have out in the next 2 months. In addition to the pilot in Bangladesh, we've also been carrying out remote implementations with MSF in Nigeria and with UNHCR and NRC in Tanzania. From these remote implementations, we've learned how to make the SWOT easier to use for field teams and how we can best support field users remotely. After about 20 months of development, prototyping, testing, refining, Version 1 of the SWOT is now live and available for the humanitarian sector to use. And we're already working on version 2 for 2021. Version 2 will bring new features to improve the function and usability for field implementers, including rapid evaluation tools for chlorine taste and odor rejection thresholds, which constitute an important upper limit to chlorination practice, as well as rapid evaluation tools for disinfection byproducts, a data visualization tool, report generation capabilities, and integration with mobile data collection platforms like Kobo. Now, the SWOT is free and open source for anyone to use, and using it entails no additional cost beyond what is normally in place for water quality monitoring. We can help reorient existing water quality monitoring programs to work with the SWOT. We're now seeking new implementing partners to use the SWOT in water systems in refugee and IDP camps, as well as in other kinds of water supply programs, humanitarian response, in which we want to demonstrate the utility of the SWOT. This includes water trucking programs, medical facilities, household water treatment, bucket and inline chlorination, and hand pumps. In addition, we want to explore applications of the SWOT in intermittent water systems in low and middle income contexts where water supply is very similar to the situation in a refugee camp. I'm very pleased to announce that we've also just officially received a new WASH Evidence Challenge grant from the Humanitarian Innovation Fund to help build the evidence space to support the scaling of the SWOT. And we'll be working very closely with Danielle Lantin's research group at Tufts University on this next phase of the project. Now, we have a number of resources and supports to assist new partners using the SWOT, including a suite of written guidance documents, online video tutorials on our YouTube channel, and a full-time staff support desk to help field teams with all aspects of the SWOT, from the data collection to Kobo surveys to implementing SWOT recommendations, chlorination recommendations, anything. Our team is standing by to support field workers using the SWOT. Now, for more information, You can reach us by email, web, or Twitter. Our instructional videos are available on YouTube. Just search for our name there. Scanning the QR code on your screen will take you to our website. Thank you again to our collaborators at Médecins Sans Frontières, at the Dodel Institute at York University for helping us build this tool. And thank you to our funding supporters at the ICMEA Foundation, Grand Challenges Canada, and the Humanitarian Innovation Fund. Thank you for listening. We look forward to working with you, getting safe water to people who need it, and to your questions. Thank you.
Wonderful. Thank you, Imran. Thank you, Imran. I'd just like to remind everyone to please use the Q&A feature. And if we don't get to your question, during the session, then please reach out to us via email. Imran just posted those emails, and I've also posted them in the chat box. They are hello, HELLO, at safeh2o.app. And of course, dighr at yorku.ca. So I'd just like to welcome our other four panelists, and I'd like to ask you to put on your videos at this time. And as you're doing that, I'm going to introduce you to our participants. Jean-François, or Jeff as he's known, Fessile, is the Safe Water Optimization Tool MSF coordinator. And Jeff is a public health engineer with 25 years of field experience in the humanitarian sector, largely working with Médecins Sans Frontières, or MSF, or Doctors Without Borders for those who prefer the English name. Jeff spent several years in the field in various positions and countries, and later moved to MSF headquarters in an advisory and research support role. He coordinates the water and sanitation unit within the public health department of MSF in Amsterdam, and he leads the water and sanitation research and innovation portfolio for the movement as a whole. Usman Khan is the Safe Water Optimization Tool machine learning lead. Usman is an assistant professor in civil engineering here at York University's Lassonde School of Engineering, and his research interests lie in water resource engineering and focus largely on urban hydrology, sustainable water resource management, and infrastructure, and the impacts of climate change on these systems. And his research interests further include designing new big data analytic techniques to improve water quality and quantity analysis and volume, I guess, in urban areas. And our third panelist is Mike Spendlove. He is the Safe Water Optimization Tool, or the SWOT technology advisor. He's an experienced director and tech leader with several years of experience in agile software development in startups and go-to-market strategies. Mike is deeply passionate about building strong engineering teams, enabling people to work within those teams, and enabling an appropriate team culture, and bringing that approach to the power of technology for the benefit of human beings in difficult circumstances. And Mike has worked with MSF as a logistician in the Democratic Republic of Congo. And our fourth panelist is Matt Arnold, who is the Safe Water Optimization Tool, or the SWOT technical advisor and the field lead. Matt's worked as a technical advisor at the Dodel Institute for Global Health Research since June of 2018. And prior to his work at the Institute, Matt was a water and sanitation advisor at MSF headquarters in Amsterdam. And he's worked with MSF as field staff, largely around water engineering since 2003. So more than 17 years of experience in this area. He has a master's in hydrogeology and a very keen interest in public health. And he's focused on how we can improve water quality and public health in humanitarian responses. So I'd just like to invite each of the panelists to just say one or two words, maybe more than one or two words, but for 1 or 2 minutes, something about their area and what they've brought to this project. Jeff, your role within MSF around the SWOT in MSF operations. Can you just tell us a little bit about that and why you've put so much emphasis on this particular technology?
Well, good evening, everyone, and thank you, James, and everyone, and all for all the presentations already. Yeah, from I think the perspective of MSF, but also for having been involved in emergencies for quite some years and seeing the importance of water and chlorination. I think my role, but the role of also of MSF and the emergency response unit that we have in Amsterdam has really been to look for answers to questions that we had, and in trying to really tackle some of the problems that we have faced in the field. And I think we've been struggling to find the right way of providing water, and we know that we have been as an implementer in the field with other partners. So we are never, it's rare that MSF is kind of on its own. But when we see a problem in the field, we need to try to involve others. And we have been struggling there in the first place, not only in this emergency, but particularly in Maban, was that we knew that we had a big problem on our hands, and we had a problem with the chlorination, because we saw that it was not ideal, and it was really a serious risk for the population. So we have always had, and that's the chance that we had. And I would like to thank the eDesk, the emergency desk in Amsterdam, for the support they gave us in trying to answer the questions that we had communication with Imran, and Imran was saying, well, there's a problem and we need to solve it, and we were supported in that. And I can mention also that we had the same in cholera outbreak, that we were supported also for finding solutions to treat wastewater. So it's not only on quality of water, for example, and that we've been supported. And I think this is also the chance that I have as an individual, but my team also, is that we are in the public health department. So we are very close to the heart of the organization, and we have access to, say, the research, and we are, supported in terms of, answering questions that we find in the field.
That's great. Thank you so much, Jeff. Usman, Imran highlighted the importance, or one of the machine learning analytics as a key component in the development of the SWOT. Can you tell us a little bit about some of the challenges that you faced in developing this and bringing it to bear in the creation of the SWOT?
Hi, everyone. Yeah, sure, James. I think one of the things Imran mentioned earlier is the importance of having safe water at the point of consumption. But there's a number of different factors that can cause water to become unsafe, making it a very complex issue, because there's chemical components, biological components, but there's also human behavior components to this, right? So it's really hard to model that type of data using conventional techniques, which is why we chose to use a machine learning based approach, which can map all of these inputs to an output. So that's one of the advantages. And another unique feature is that we can update these models on a fairly regular basis, fairly easily, which means that any changes that might happen in these camps, whether they're operational or behavior changes or climate related, based on what season it is, those things also get captured in our model. And another advantage of this approach is we can actually produce risk-based targets or non-deterministic targets. Instead of having a single output, we provide a range of outputs saying, we can guarantee safety at this amount or at this percentage. But there are a lot of challenges when we're using a machine learning approach. The first being we need to have access to data, and that's something that the SWOT is trying to tackle as well. as Imran mentioned, that we need data, we need paired data samples. So we need it at the tap and from the shelter. But
So
having
the risk-based approach that you just talked about, is that disease specific? So for example, hepatitis E, do you need a certain level of chlorine in order to appropriately address that risk?
I don't think we're doing it on a specific disease basis. We're doing it based on ensuring a certain target of FRC at the point of consumption.
Okay, but we could, right? We could become
Exactly.
specific. So that's really what you're getting at. That's great. Thank you, Usman. Mike Spendlove, could you just talk a little bit about some of the technical challenges that you faced around development of the software architecture, for example, interfaces and so on. It's a fascinating area that really is vital, to the utility of a tool like this. So if you could just outline some of the challenges you faced there, that'd be great.
Perfect. Thanks so much, James, and very honored to be here amongst my fellow panelists. Yeah, like I've been working in app development for about 12, 15 years, and oftentimes the biggest challenge in engineering is defining the problem the right way. When Imran approached me about this particular problem, I felt, it's very difficult for technology to solve for public health outcomes directly. Oftentimes you need to narrow that problem to something very precise and technical. And this particular problem of optimizing the use of chlorine in order to purify water at the tap stands, and then following that, readings in households just seemed to be the perfect application. And that problem was actually, a lot of that work was already well defined. So at that point, it was really just about determining the best solution architecture to enable this to be scalable, to be able to be implemented quickly. So we're using things like DevOps and automated builds to ensure that we're able to respond quickly. We're using cloud hosting to ensure that we're minimizing infrastructure costs and so on too. And also a range of technologies, MongoDB and others, to allow future expansion. And so those were all considerations that led to the ultimate solution architecture.
Fantastic. Thank you, Mike. Matt, I wonder if you could just say a few words about some of the challenges around field trials and implementation in Bangladesh, Nigeria, Tanzania, for example. I know that you were deeply engaged in each of these activities. And then finally, I wonder as well if you could just briefly say something about hepatitis E. This is a key issue, and Imran raised it in his presentation as a catalyst, if you will, for the creation of the SWOT. And I know this has been a primary concern of yours from our various conversations over the last while. If you could address those two issues, I'd very much appreciate it. Please, Matt.
Yeah, no problem at all. So firstly, in terms of the field implementations and the trials, the three pilots, I think they were quite different models, in that one of them for Nigeria was directly with an MSF team. So I was dealing, so it was remote from my perspective, but dealing with an advisor in Amsterdam. The one in Tanzania was through UNHCR. So actually monitoring and evaluation officer working in Tanzania for UNHCR with various implementing partners. So I think that there, because we're two steps removed from the people actually working in the field, that quite obviously can present some challenges, particularly with something that's new. I don't think that measuring FRC levels, free residual chlorine levels, is something that's new, but adapting to a protocol to fit the SWOT is something that's different. So of course there's bound to be challenges there. I think also, if I'm very honest about the Bangladesh experience, and we ended up collecting a lot of data there. What was interesting is I've seen that context, and of course many others from the perspective of a practitioner, someone involved in the response. It's interesting when you arrive somewhere with what everyone perceives as a research project, which I really want to underline in all of this is research to actually do something and come up with something. But the perception is a bit that you're coming to research something in the shorter term rather than put something in place that could be there for longer. So in terms of that experience directly in Bangladesh, I mean, really, the protocol is very simple. The amount of equipment required is incredibly simple. There is nothing complicated about this at all. We've smoothed out some of the issues around actually entering the data. There's a bunch of instructional videos that have been done, which has been some of my more recent work. And on top of that, I just reiterate that we're here, of course, to support. So that's a bit of perspective on that side of it. If I'm to talk about hepatitis E, I've seen the question that has come regarding that. And of course, I'm fully aware of this discussion, which within MSF originated from a water supply intervention in Mornay IDP camp in Darfur in 2004.
Could you just restate the question for people who aren't seeing the chat? Just tell people what the question is.
Okay, so we know a specific one on HEV, hepatitis E, as it's been mentioned. We know HEV shows a certain resistance to chlorine, which level is still unknown as far as I know. That's the questioner saying that. Would the SWOT newly recommended FRC levels 0.8 to 1 milligrams per liter be sufficient to tackle hepatitis C? Would that be a field for further research? So if I just take a few of those things. So firstly, in terms of the resistance to chlorine, I was looking into this recently. I mean, there's a paper which was published, hang on, not that long ago. Oh no, sorry, no, some time ago now, a few years ago, which certainly the results of that imply that a normal level of chlorine, i.e. between 0.2 and 0.5, can be expected to work. That is not to say that I can sit here and conclusively say that, because that's not the point of the SWOT at the end of the day. And the point is that it can be adapted to any further evidence that might come, which might be context specific or something that's found out in general about possible resistance issues. It's not that the recommendation 0.8 to 1 milligrams per liter, which we might have found in some places, is appropriate somewhere else, or in the same place in the future with increased knowledge. It's not doing that. But in terms of the last question there, would this be a field for further research? Yes, of course. I think that there's plenty of opportunity for that. But and to also to state clearly as well, the SWOT is not necessarily about increasing FRC levels. This is about better managing with the knowledge that we have now, and better accountability towards the recipients of water.
Thank you.
There's a lot more I could go into about the hepatitis E question, but that, from the point of view of the SWOT, that is what I can say.
Okay,
about it.
Terrific. That's very helpful. Thank you. Imran, I'll just, maybe we're really running short of time here, so I'll perhaps give you the last word on this. Could you just very quickly address some of the engineering optimization analytics and the challenges there? And then could you also just address what are the next steps, the next big questions around use of the SWOT, and particularly the question of chlorine odor and the people's willingness to use water that now has an odor to it?
Absolutely, James. Thank you to the attendees for those questions. We see a number of them, and if we don't get to them now, we will follow up afterwards directly with responses on email. So for the question about the numerical modeling, as I mentioned in the presentation, this is the first time that anybody has looked at the engineering problem of how do you model chlorine after it leaves the distribution system? We've been doing it inside distribution systems since the 80s and 90s, and it's pretty robust and proven technology. No one has ever looked at it before after distribution because it wasn't a problem in urban settings in the developed north. It's a real public health problem in intermittent water systems in developing countries and in refugee and IDP camps. Anywhere there's a gap between people collecting water and then storing and using it and drinking it downstream. So we had a lot of not problems, but challenges. It's a brand new problem for us to solve. And so we took what is known about chlorine decay modeling in the literature. We looked at some of its fundamental concepts. We modified some of the assumptions. We used what we could. We changed what we had to. And then we developed an approach that could, to some degree, model the variability that we see in post-achievement chlorine decay. Now, one of the challenges we have to work on, and this is something that the ANN is actually very good at, is moving to a risk-based approach. Right now, we generate a very deterministic output from the numerical modeling approach. That's probably not the best for field users. So we want to move into a risk-based approach which the ANN is able to do, and we're working on that now. In terms of next steps, and I want to address the question about chlorine taste and odor. This is a common concern with chlorination, is taste and odor-driven rejection, leading people to go to unsafe sources in the environment. So when we chlorinate water in humanitarian response, we're designing between two boundaries. You want to have the minimum for public health. That's what the SWOT gives you. And you don't want to exceed a maximum that will lead to rejection and people going to unsafe sources. So you're designing between two boundaries. Right now, the SWOT is taking care of the bottom. We also want to work on the top. So further to that, we're developing rapid protocols for evaluating in each particular emergency site in each population, what is that threshold? And what we do know is that the threshold varies quite a bit from population to population. Some people are very accustomed to chlorination, so they have no problem with it. In fact, they prefer it because it's indicative of a public health protection. Others who are not accustomed to it may reject it. And we've seen both of those things. But we need to have data from each specific population. What is that limit? What we know is that through habituation, people can also get used to it, and through public health promotion efforts, we can increase that limit to be within the public health requirements. So there's a lot we can do there. 2021. James.
Okay, thank you, Imran. So I'm going to invite our panelists to raise a glass of, in my case, coffee. And in others, I'm sure there are more spirited offerings. But I'd like to ask our panelists to raise a glass, and I'd like to propose to toast the launch and the future success of the SWOT tool. It's the result of an incredible collaboration from our donors, from our partner organizations, and from people who are genuinely committed to improving people's lives in the most difficult of circumstances. So to success.
Cheers.
Thank you.
Hello.
You actually have to drink from that, Imran. I hope it's appropriately chlorinated. And with that, I'd like to thank everyone for joining us today. And please do reach out to us. The emails are in the chat box. And I would like to thank you for participating